Hi, my name is Galen Clark, and I'll be performing a musculoskeletal neurological exam on my patient. Today we'll be doing upper extremities, lower extremities, spine, joints, and the neuro assessment. First, I'm going to inspect your upper extremities. There's no obvious deformity. I'm going to palpate your joints, including your shoulders, elbows, and fingers for any nodules, fluid buildup, and I'm not feeling anything abnormal. Okay, testing range of motion and strength. Go ahead and bring your fingertips to the ceiling, to the floor, and then straight out. Go ahead and spread your fingers out, bring them together. Go ahead and try to spread them. Spread your fingers, okay. Push up and push down. Good. Go ahead and flip your arms over. I'm going to put some pressure on your wrist. Go ahead and push up. And push up. Okay. Put your hands back like that. Go ahead and close your eyes. I'm going to do a sensation test. I want you to tell me whether I'm raising your finger up or down, okay?
Down. Up.
Okay.
Up. Down.
Very good. Okay, go ahead and put your arms out straight, open your eyes, and bend your elbow up to your shoulders, and go ahead and bend them back down straight. Good. You'll probably have to stand up for this part. Go ahead and face that direction. Raise your arms above your head, touch your hands together, and bring them down and behind you as far as you can. Good. Okay. And that is all for the upper extremity. Go ahead and sit back down for me. For the lower extremities, I can most certain already tell that he doesn't have a balance problem. He's able to stand without falling over. Looking at your legs, I can tell that there's no obvious deformity. Your skin is pink, warm, dry, and intact. Your body hair distribution is equal and normal. There's no varicose veins. So we'll go ahead and test your range of motion and strength. Go ahead and lay down for me. Okay, first testing his range of motion of his hip. Since I have a couch, I'll only do his right side, but in a clinical situation, I would do right compared to left. So go ahead and raise your leg up to the ceiling for me and back down. Bring your knee to your chest. Okay, and back down. And then just bring your knee up. Okay. Go ahead and rotate your hip inwards while laying straight. And then back again. Straighten out your leg for me. Okay, now I'm going to abduct your leg out to the right. And go ahead and push resistance on me as I try to put it in. Okay. Now go ahead and straighten your leg. So that did his hip. Next, I'll move on to his feet and his ankles, and then when he stands back up, I'll recess his knees. So I can palpate his knees as well as his hips. There's no, again, obvious deformity or fluid buildup noted in his knees or his ankles. Joints in the feet. Go ahead and bring your feet up to the ceiling and then drop down. Bring them in towards your body and then outward. Okay, go ahead and apply some resistance. And again, flex your toes, curl your toes, and then fan them out. Okay, you could do a Babinski exam, and I'll just stroke the inside of your foot. And it was negative, which is normal in somebody his age. So go ahead and stand up for me. Okay, go ahead and face that direction. Again, looking at the backs of his legs, no obvious deformities. You could try to palpate the popliteal pulses back here. Go ahead and flex your knee while standing. There you go. And now with the other one. Okay, go ahead and do a shallow squat for me. Just bend at your knees. Okay, good. Now stand up straight. With him standing like this, I'll do a Romberg test where I just assess that he's standing with his feet together and his hands at his sides and he's not swaying. Go ahead and close your eyes for me. Again, he's not swaying with his eyes closed, and this would be a normal sign. Next, we'll inspect your backside, your spine, just you standing straight and tall. There's no obvious deformity or curvature, abnormal curvature like lordosis or kyphosis or scoliosis. I can palpate his spinal process C7. Go ahead and try to touch your toes. And the spine stays straight. Stand up straight for me. Take your right shoulder and turn to the left. And then turn to the right. Good. Okay, and now try to just stretch back as much as you can. Okay, now straight. Go ahead and put your chin to your chest and to the ceiling. Turn to the left and to the right. Okay, his cervical, lumbar, and thoracic spine seem to be all within normal range of motion. Go ahead and sit back down for me. Next, we will be doing the neuro part of the exam. So one of the first tests that we'll be doing, I want you to copy me exactly. It is a movement test. I want you to slap your palms on your legs, bring them up, and then with the back side of your hands, and just keep repeating over and over as fast as you can. Okay, good. So that was easy for him to do. Next is going to be the nose to finger test. When I say touch my finger, I want you to touch my finger with yours. And when I say touch your nose, I want you to touch your nose, okay? So touch my finger, touch your nose, touch my finger, touch your nose, my finger, your nose, my finger, your nose, my finger, your nose. Okay, that was also easy for him to do. Next, I've got a sensation test. While I already did the test with his fingers, and he was able to tell me whether or not I was lifting his finger up or down. Next, we're going to do sensation on his body. I have a Q-tip, and I've got a sharp edge, and then I also have the dull, soft edge. So go ahead and close your eyes for me. And I'm going to touch a part of your body. I want you to tell me what body part I'm touching and whether I'm using the sharp or dull edge, okay?
Sharp arm. Soft face. Sharp foot. Soft leg.
Okay, very good. And those were all correct. Next, I'll have you go ahead and lay back down for me. And we're going to do the heel to shin test. And what you're going to do, you're going to bend your leg at your knee, and you're going to take your heel and just brush it straight down your shin, and do it with the other leg. Okay, and he was able to do that without any problems. So that concludes our musculoskeletal neurological exam.